cases of the coronavirus continue to surge nationwide. So far, the United States has confirmed nearly 3 million cases, at least 131,000 deaths. The 7-day averages in a dozen states have hit new highs, with the U.S. adding nearly 300,000 cases during the first week of July. Now, fears are growing over the rising number of hospitalizations across many states. In Florida, Texas, and Arizona, hospitals are reporting they are at capacity or almost there. Yesterday morning, Arizona announced 89% of the state's ICU beds are full. Dr. Anthony Fauci warned that the United States is still experiencing the first wave of this pandemic. He spoke yesterday during a live stream interview with the director of the National Institutes of Health.
The current state is really not good in the sense that, as you know, we had been in a situation where we were averaging about 20,000 new cases a day. 2 days ago, it was at 57,500. So within a period of a week and a half, we've almost doubled the number of cases. So in answer to your first question, we are still knee-deep in the first wave of this. And I would say this would not be considered a wave. It was a surge or a resurgence of infections superimposed upon a baseline, Francis, that really never got down to where we wanted to go.
Let's bring in Dr. Vin Gupta. He's a pulmonologist who has treated critically ill coronavirus patients in Washington state. He also is an NBC News medical contributor. Dr. Gupta, great to see you as always. Frankly, this is something that Dr. Fauci has been saying for a long time. This is not a second wave. It didn't go away and now comes back. This is the way he laid it out. This is the way that Dr. Birx laid it out. This is the way you've been telling us it's going to take place for about 3 or 4 months now. So where are we now in the phases of this pandemic?
Good morning, Willie. Always good to see you. You know, hospitalizations are rising at a concerning rate nationwide. So we're seeing models published on the CDC website showing that anywhere from 1,000 to 15,000 new hospitalizations every single day by the end of this month. That's deeply concerning. What I'm really concerned about are my friends and colleagues in Arizona who are fighting in ICUs to keep patients alive without the support of military or National Guard forces to bolster ICU capacity. At least Governor Ducey has activated the National Guard to some degree. In Texas, in Florida, in Florida, in Georgia specifically, you've seen the National Guard activated to quell protests, but not to bolster ICU capabilities. And Willie, I'll say this right now, you know, we're dealing with a mini surge here in Washington state from what's happening in eastern Washington, some of the Native American tribes in and around Yakima. It's not easy to, on a dime, flip a switch and say, we need more dialysis nurses, we need more ICU docs and nurses. You just can't do that. You need to plan ahead. We're not seeing that forward thinking, especially in states like Florida and Texas, and people are going to die.
Dr. Gupta, the president, as you know, and others have touted the low death rate in this country. And if you look at it, the deaths are down in terms of the pace at which they've been accelerating over these months. What does that tell you? We had Dr. Ashish Jha on yesterday at this time reminding us that deaths are a lagging indicator and they may follow cases, but also that we are learning that doctors like you have learned how to treat coronavirus patients better. So what do you read into the death rate in this country?
No, I appreciate that, Willie. As Dr. Jha mentioned, in March, I didn't know how to save a patient's life on a ventilator with COVID-19 as well as I do now, as well as my colleagues do now. I know that if you're young, if you're old, and you come in and need a vent, you probably need to be on a blood thinner. I probably need to give you steroids now at high doses. I didn't know that even a few months ago. And then you also need to be put on your belly. We call it prone positioning if you're on life support, on a ventilator, needing assistance to breathe. These are interventions that have allowed us to save more lives amongst those that are critically ill. So yes, treatments are better. We also know that with testing, we're testing and finding that more individuals are younger. We're seeing the median age of new infected individuals drop from 65 to 35 in Florida. That means that you're still going to see people end up in the ICU, whether you're young or old, but they're more likely to survive COVID-19. Doesn't mean they're not going to have harmful effects from it. I've seen individuals as young as 20 have strokes, have long-term impacts from COVID-19. So the president's messaging on harmless versus harmful, deeply dangerous, deeply damaging to the cause here. So those are two things. And then, yes, lagging indicators. We're seeing deaths happening likely from infections that occurred at least potentially a month ago. It's the case that some individuals come down with COVID-19 and then immediately die. But it's the majority of cases you're seeing, it takes a while. I have patients that are on ventilators for 45 days before they present themselves one way or the other, that either they're going to make it or they're not. So that lagging indicator piece is also critical.
And psychologically, I think, as you and I have discussed, a lot of people in this country saw the crisis at the beginning in March and April in New York City, the explosion of cases, the explosion of deaths, the overrun ICUs and emergency rooms. And they saw those numbers come down and perhaps were lulled into a false sense of security. Where are we now in terms of states that have rolled back, who have said, OK, we're going to open our businesses, and now Florida, Arizona, Southern California, Texas, Georgia, Tennessee are saying, wait a minute, we need to pull back a little bit. Where do you want us to be in terms of those kind of regulations? Should we have mandated masking in America, for example? What should this country be doing to stem this outbreak we're seeing right now?
Thanks, Willie. I think there's three things every governor should do. Ideally, the president should be messaging on this as well. Enforcing masks, not just mandating it, but enforcing it. Willie, I'm worried that if we just say, let's do a national mandate on masks, who's going to enforce it? It's going to be the lone security guard or a good Samaritan. It's a dangerous situation because masks has become political. We need enforcement. Something simple like if you don't wear it, you're going to get fined, like with indoor smoking. And that's controlled people's behavior, believe it or not. So that's number one. Number two, I love what Governor Murphy and Mayor Bill de Blasio have done. They've stopped indoor dining. They've paused it. Outdoor dining, okay. But indoor dining, we know transmission rates increase up to 20 times relative to outdoor dining. Just the lack of ventilation, the fact that we think that there's some degree of airborne transmission with COVID-19 in confined spaces. I think every state, every zip code in the country needs to rethink indoor dining for the time being. And then, Willie, I'm going to message this again. I'm a reservist ICU doc with the Air Force. We get taught how to put up portable ICUs and elastic hospital capability quickly. Governors in Florida, Governor DeSantis, please, Governor Abbott in Texas, you need to deploy any assets you have available, up to and including your National Guard. President Trump needs to stop politicizing the deployment of the military and think about utilizing military forces as well.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.